Hi friends, this is Dr. K.S Vivekanandan, Psychiatry faculty for Dr. Bhatia Medical Institute, eGurukul. I'm very happy to welcome you all to this YouTube session where we are going to deal about the NEET PG previous year questions. I used to always tell this to students that please concentrate on the PYQs because PYQs is the core where you can score a lot of important questions and important most repeated questions will be from the PYQs. I'll just share one incident where we came to know the importance of PYQs and we teachers started to increase our concentration on PYTs. Is that, see, it was not many years before, it was just last year. What happened was we did a NICT PYQ revision. Yeah, it was around April 2023, and within a month in the INICT May 2023 we got nearly 11 questions in psychiatry, in which 9 questions were from previous year topics. Okay, that is the importance of previous year topics. They will definitely not ask previous year questions. We are not doing 6th standard or 7th standard in school. Definitely it will be from previous year topics. So if you read the question and read the topic that is related to that question, naturally the chance that you will be able to get the same question from the first question from the similar topic is more, there is a more good chance. Now what we did was, rather than just taking the questions from the last 3 years, because it was coming only for a few questions, so we continued it until from 2023 to 2018. Okay, a full stretch of 5 years has been taken, and we were just counting on what are the number of questions that has been asked from the various topics. Okay, uh, hi Sultan Afil, good morning. uh, Good morning, Divya Biraj. I'm very happy that you're all meeting. And now, what are we going to do is we are going to concentrate on each and every question in detail. We are going to discuss it in detail so that the PYT part of psychiatry is over within the next 2 hours. Yes, that's the spirit. Thank you for joining, Dr. Sultanafil, Dr. Divya Biraj, Dr. Harija Fatima. Very nice to meet you all. Now when we saw the when I just categorize the questions into various topics, the what are the topics that is given more importance in psychiatry from the various topics is that, see, we always give importance to schizophrenia and we spend nearly half a day in our class, but we got only one question from schizophrenia. Mood disorders is a very good number, that's 4. OCD and neurosis is 5, and the star means it has been exact repetition of the question is exactly repeated. Okay, and eat disorders, sleeping disorders, sexual and personal disorders ranks the first with 6 questions, and it has also repeat questions, not only repeat topics but repeat questions. Substance use disorders 4. Pediatric and psychopharmacology again 4. Psychology, again we find that there are increasing trends of questions that has been asked in psychology, and also mental status examination. So this is a wide content, so we're going to jump into the topic and we are going to discuss each question in detail and the topic related to the question. We are not just going to the question and answer. By this time I think you'd be by hearting, for the moment I start the question you know the answer. We're not going to do that. We are going to discuss the topic. I'm telling you friends, this is an investment and you will reap success, that I believe, and you will definitely see the difference. Yes, MGB, that we'll be discussing everything related to the question. So we'll start from the recent questions. A medical student, a middle-aged female, presented with complaints of repeated episodes of around 30 minutes characterized by breathlessness, palpitations, sweating, hyperventilation, and fear of impending heart attack. The patient has been having these episodes 2 to 3 times a month the last 6 months, and the investigations didn't reveal any obvious abnormality. What is the diagnosis? This is one of the most repeated question. Again, I'm going to put a star here because it's one of the most repeated question, and it's not something new, and it's something which is like I used to say, whenever there is a question on panic attack or panic disorder, we feel that 95% of the times the question will be a clinical related question. Okay, a 40 years old female after a divorce comes to the casualty, and you are the casualty medical officer. The patient presents with palpitation, breathlessness, sweating, giddiness, feeling of impending doom. What is the diagnosis? Answer, I think everybody has got it right. This is panic disorder. Yes, there should be no confusion in this. There should be no doubts in this. Now I'm going to ask you certain questions. What are the symptoms of panic attack? Please start typing. Yes, friends. What are the symptoms of panic attack? Very good. First and foremost, you will have what is called as palpitations. All questions will have this word palpitations. Then you will have what is called as breathlessness. Then you will have tremors, impending doom. You feel that something will happen crazy. Okay. And very importantly, they might also have something called as a choking sensation. I promise you, friends, this is a repeat question, and there is a good chance that they will ask a clinical related question. Yes. Now, I have asked in my Instagram channel also, what is the difference between panic attack and panic disorder? This is very basic. This is very basic. Differentiate what is panic attack, what is panic disorder. Both is not the same. Yes. Thank you. Thank you. Wonderful. Wonderful. I see a lot of students which is answering. Naturally, whenever students answer, I get too much of stuff. I get too much hyper, and I used to teach a lot of things. So if I'm going to take too much time, please bear with me. Yes. Yes. What is the difference between panic attack and panic disorder? Very simple. A person having this palpitation, breathlessness, sweating, giddiness, feeling of impending doom, this cluster of symptom is called as panic attack. This cluster of symptom is called as panic attack. But what they are going to say is that when the symptoms are followed by at least 1 month, okay, where the person is having a persistent concern, you are worried that this will again happen, or if I go in this place I will get a panic attack, then and you are restricting your behavior, you are avoiding, there is a change in your behavior, then we call it as disorder. Then we call it as a disorder. Are you able to find the difference? Are you able to find the difference, friends? Yes. Yes. Yes, very good. So when the question says that there are multiple episodes, he's very much concerned that he's going to get the episode, then they are going to call it as panic disorder. Yes, friends. Yes, friends. Are you very clear on this? Yes. Now, extra points that you should know about panic attack is that what are all the organic conditions that you will look into when you are seeing a panic attack patient. See, whenever you see a panic attack patient, a person comes with palpitation, breathlessness, sweating, giddiness, feeling of impending doom, you are not going to rush into a diagnosis called as this is panic attack or this is panic disorder, because panic attack and panic disorder is a disorder of exclusion. You need to exclude a lot of things, then only you will come to the diagnosis of panic disorder. Yes. Yes. Please tell me what are the organic conditions where you will have this panic, so similar to the panic attack. Yes. Please tell me what are the organic conditions. What are the heart conditions you will have panic attack? Definitely MI and arrhythmias. MI and arrhythmias. Yes. 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 Very good. When it comes to the lung, as our friend is saying, yes, Aisha, it's asthma. When you have a thyroid condition, you have a hyperthyroidism. And very importantly, one thing that you should be very much aware is that what is the substance intoxication which will present like panic attack. This is very important. What is a substance intoxication which will present like panic attack? Who's going to answer this? What is a substance intoxication which will present like panic attack? Yes, it's very, 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 very important. Often asked in exams. Cocaine. Cocaine is not in choice. Go for amphetamine and cannabis. Yes. Now there are questions. Excellent. Wow. Ashita, please stick to cocaine, because there has been a question that has been asked in the previous year exam. It says that a person is having palpitation, breathlessness, sweating, giddiness, feeling of impending doom. The family members gives a history that the person has been using one substance. What is the substance? Always go for cocaine. Okay, if cocaine is not in the choice, I will definitely go for amphetamine. If amphetamine is also not in the choice, I will stick into the answer that you are given, that is cannabis. Yes, friends. Now, sir, a person is having generalized anxiety disorder. Can you explain what is generalized anxiety disorder? As the name denotes, the question will say that the person is anxious about everything. The very catchy word that you should be always concentrating is the person will have free floating anxiety. The person will have free floating anxiety. This is a word that you are going to search in the question. Next, there was one question that has been asked, okay, where the person will have both psychic symptoms and also physical symptoms, where the person will have muscle tension, rigidity, and all that. But the free floating anxiety, anxious about a lot of things. Okay, and very one question is that the person is worried. Okay, this was a question that was asked in one of the exams. The person is worried that his parents would die someday, many years later. Okay, see, we all know that we are going to die. We are just temporary human beings. Same thing happens to our parents, and also that's going to happen to our kids. But thing is that he is concerned today. He's very much anxious today for things that is going to happen in future. Okay, and it's not only about it. He's also, there is a massive physical symptoms of anxiety is there, psychic symptoms of anxiety is there, and it's anxious about everything. That is a free floating anxiety. Please search for the word free floating anxiety, which is a clue that the examiner wants you to go to the answer of generalized anxiety disorder. And definitely there will be no contamination related points in the question. Contamination or the feeling that the hand is dirty. There will be no fear of impending doom or fear of heart attack, and there is no avoidance or fear of a marketplace or fear of a crowded place. Is this clear? Is this clear, friends? Yes. Next, there is something called as social phobia. This is very, very important. Social phobia means you are in the front, you feel that you are in the front of scrutiny, people are judging you, people are, this is basically a performance anxiety. Okay, where you have to, where people are seeing you and you are a matter of embarrassment, or there will be some of humiliation, and there should the people you worry that they will evaluate you in a different way or in a wrong way, or they are going to judge you. It's basically you're very comfortable inside your house, but outside in a social situation where people are going to notice you, you're going to have an anxiety. You try to avoid situations where you're going to get attention. That catchy word answers you of social anxiety. See, I'm not teaching concepts here. We are talking about questions, ways to answer the questions, way to find the catchy words. Yes, friends. Yes, friends. Thank you. So this is the things that I have told about this question: panic attack, panic disorder, generalized anxiety disorder, and social phobia. Yes, yes. Thank you. Raghunandan. Hi, Raghunandan. A 32-year-old male patient presents to psychiatry OPD with a history of recurrent premature ejaculation that leads to interpersonal conflicts. Which of the following can be recommended as a non-pharmacological treatment in this case? I am saying you friends, this is the exact repeat question. Okay, even 10th standard and 12th standard students are not getting exact repeat question, but NEET examiners, kind-hearted examiners like me will ask repeat questions, not only repeat topics. This is an exact repeat question. Yes, you should not make any mistake in this. What is the answer? First tell me the answer, then I'll go to the discussion. Yes, everybody got it right. This is nothing but squeeze technique. Yes. Now you should know that there are some phases of a sexual cycle. Tell me, what are the 4 phases in a sexual cycle? What are the 4 phases of sexual cycle? And every sexual phase, you need to have one disorder or one point to remember. What are the 4 phases of sexual cycle? Yes, we have something called as desire phase. Very good, very good, very good. Raghunandan, what is the next phase? What is the next phase? Excitement or arousal phase. Then you have something called as the orgasm phase. Yes, and then you have the resolution phase. Tell me a disorder which happens in the desire phase. You all know this. It is hypoactive sexual desire disorder. What is the disorder that comes under excitement phase? What is the disorder that comes in the excitement phase? Excitement in males. Very classical disorder. Very common disorder. What is the excitement phase? What is the problem? Erectile dysfunction. Orgasm phase. This is again a question. It's a most repeated question and it has been repeated. It is nothing but orgasm is what? Most common is always common, friends. Common is always common. So always go for premature ejaculation. Yes, premature ejaculation. Now, this erectile dysfunction, I'm going to classify into 2. Okay. Erectile dysfunction, I'm going to classify into 2. Yes. One is called as organic. Another is called as psychogenic. As a person who's going to, just with the history, you're going to diagnose this is organic erectile dysfunction, this is psychogenic erectile dysfunction. You need not go for USG, you need not go for any investigations, you need not do any scan. Just with one history, you'll be able to know that this is organic, this is psychogenic. Who's going to answer this question? Who's going to answer this question? Organic, a person is coming with erectile dysfunction. How will you classify it as organic or psychogenic? With just history taking. You're not even examined, you're not even evaluated, you're not even investigated. What is the investigation, or what is the question that history that you're going to ask? Yes, friends. Anybody wants to try? It is nothing but I'm going to give it to Dr. Ramya. Wonderful, wonderful. It is nothing but early morning erections. See, please have it very clear. There will be 2 questions that will be asked. A 60 years old male, non-diabetic, hypertensive, dyslipidemia, on the medications for these problems. And when history of it comes with erectile dysfunction, on history of early morning erection, he is not able to remember when he got erection the last 6 months. Then in organic, so basically there will be no early morning erections. Whereas in psychogenic, there will be early morning erection. Yes, so there will be a 35 years old male who is recently married, coming with erectile dysfunction. He's having early morning erections. Yes. Now, what is the treatment? What is the treatment for organic erectile dysfunction, and what is the treatment for psychogenic erectile dysfunction? Yes. What is the treatment for organic erectile dysfunction, and what is the treatment for psychogenic erectile dysfunction? Organic erectile dysfunction, you're going to go with medications. Naturally, what are the medications you are going to give with? Yes, sildenafil, tadalafil. So basically phosphodiesterase inhibitors. What is the treatment for psychogenic erectile dysfunction? Phosphodiesterase inhibitors. Very good, Aisha Zahid. What is the treatment for psychogenic erectile dysfunction? Anybody wants to give a try? Yes, wonderful, Aisha. Master and Johnson technique, also called as dual sex therapy, also called as sensate focus therapy. Sensate focus therapy. Yes, yes, very good. Now again, you're going to go to the premature ejaculation part. Premature ejaculation, again, you're going to go into organic premature ejaculation, psychogenic premature ejaculation. Yes. Now, what is the treatment for organic premature ejaculation? What is the treatment for psychogenic premature ejaculation? Yes. Wonderful, wonderful. Sildenafil is answering sensate focus. Wow. Nice. Good pair. But what is the treatment for organic premature ejaculation and what is the treatment for psychogenic premature ejaculation? Anybody wants to give a try? Yes. Wonderful, Aisha Zaid again. Depoxetin. Depoxetin is an SSRI which is used for premature ejaculation. I always, whenever I used to teach in the class, I also used to say here itself. Please repeat with me. Duloxetine is an NSNRI used for neuropathy. You will get confused. So please read it here itself. Depoxetin is an SSRI used for premature ejaculation, whereas duloxetine is an SNRI used for neuropathy. Whereas for psychogenic premature ejaculation, the answer treatment of choices, as we have already dealt, we have something called as, first you will start with sex education, because a lot of times there will be a lot of miscommunication and misconceptions. Next we have something called as start and stop technique. Start and stop technique. Okay, a very famous question in CMC. When the CMC had a special paper, they used to ask start and stop technique was given by. Now we are in NEET, so they might be psychiatrists who are interested in sexual medicine. They will ask this question: start and stop technique was given by anybody? James Seaman. And the question of that they asked now is a squeeze technique. Yes, yes, friends. Yes, very good, Silnafil. You're rocking. Is it clear, friends? Yes, yes, yes. Can I proceed? Can I proceed? Yes, yes. Next, we'll go to the NEET PG 2022 questions. Yeah. Yes. A 16-year-old female was referred for irresistible urge to eat. Okay, she's eating. There is an irresistible urge to eat, followed by episodes of self-induced vomiting. She's vomiting. The patient is also on appetite suppressants. What is the most likely diagnosis? Let me see who's going to answer this question. Yes, yes, friends. What is the answer for this question? There is a irresistible urge to eat and they have self-induced vomiting, also on appetite suppressants. What would be the most likely diagnosis? Anybody wants to give the answer? I would go this for bulimia nervosa. Okay. Now, why I went to this answer is nothing but I'll give you an explanation. First and foremost, please concentrate whenever there is a question on anorexia nervosa. Whenever there is a question on anorexia nervosa, you should be finding the keywords that the person is lean and the person is having body image disturbance. Though the person is lean, the person has a body image disturbance and he wants to is to reduce the weight. Okay, so that is nothing but lean and body image disturbance are the very catchy words. And the new addition in DSM-5 is that they have included a BMI as a very important point. What is a BMI? What is a BMI cutoff for anorexia nervosa? Anybody? A person who is lean, naturally the person will be like this. Okay, we draw it like a stick diagram. Yes, 17.5, less than 17.5 is the cutoff. Now, what is the DSM-5 criteria which is removed in anorexia nervosa was amenorrhea was once a criteria is being removed. It is removed from the diagnosis. You need not have amenorrhea as a criteria to diagnose anorexia nervosa. Yes, anorexia nervosa. Yes. Next, we have something called as bulimia nervosa. We'll go to bulimia nervosa. Now, I have answered this as bulimia nervosa because here the person will be of normal weight. Okay, the person will be more impulsive. Because of that impulsive, they will binge eat, and because of the binge eating, what happens is that they have a lot of guilt, because of which they'll have this self-induced vomiting. Yes, self-induced vomiting. Yes. Now, because of the self-induced vomiting, you'll have what happens to the electrolytes and what happens to the hand. Already, I think one of our friend has answered. We have something called as Russell sign, because the teeth will cause injuries over the knuckles, and that is called as what sign? That is called as Russell sign. That is called as what sign? Russell sign. What are the physical symptoms? What are the electrolyte abnormalities that you are going to expect in bulimia nervosa? Answer me. What are the physical symptoms, or what are the electrolyte abnormalities that you're going to expect in a person? You're going to have continuous self-induced vomiting. So basically, what is going to be lost along with the food? What is going to be lost? HCl. So what happens? We'll have hypokalemia, hypochloremia, and alkalosis. Yes. Now there was one question which was asked: what is the antidepressant that should be specifically avoided in a patient with bulimia nervosa? I hope you would have faced this question. A person is having bulimia nervosa. One antidepressant should not be given. Anybody who wants to give the answer for this? If you answer this, I will recommend MD Pharmacology in one of the main colleges. What is the antidepressant that should not be given in bulimia nervosa? Yes, anybody? Anybody wants to give a try? One antidepressant should not be used. Wonderful. I'm going to give it to for sildenafil. Bupropion. Can you tell me why bupropion should not be given to bulimia nervosa? Why bupropion should not be given to bulimia nervosa? Very good. A lot of them are answering bupropion. You would have seen this question definitely. But I want the answer. I want the answer. Explain me that so that I know that I'm confident that you have understood the concept clearly. Why am I not giving bupropion in a patient with bulimia nervosa? Because bupropion has a chance that bupropion, what is the side effect or dose related side effects? When the drug dose is increased, it will cause seizures. Very good, Lakshmi KM. Brilliant. I will recommend you to take MD pharmacology in Madras Medical College. So basically what happens is that there will be seizures. Now here there is electrolyte abnormalities and there is a risk factor, and so basically when you give bupropion at high doses, there is increased chance that the patient will have seizures. And this is a previous year INICT question. See, I'm telling you friends, don't feel that okay, this is a NEET exam, I'm going to read NEET question. No, for NEET you read INICT and also FMGE, because I'm discussing points which has been asked in FMGE and also INICT here itself. What is the SCOF questionnaire? SCOF questionnaire is used for, anybody? SCOF questionnaire is used for, definitely they will not ask what is SC and O and F. They're not going to ask like that, but definitely you should be knowing that SCOF questionnaire is used for where? Eating disorders. Basically what happens, it will be like S stands for do you make yourself sick because of uncomfortably full, or do you think you have lost control over the diet? Have you lost 1 stone? And do you feel yourself fat? Do you feel that food dominates your life? So that is, each word will have one word. Yes, very good. Next question. After 5 days, please concentrate, this is a catchy word, this 5 days, if you read the 5 days, you know the answer. After 5 days of normal vaginal delivery, a woman brought to the casualty at 11 p.m. by her husband with history of tearfulness, mood swings, occasional insomnia, loss of appetite, difficulty in sleeping, feeling of low self-esteem on day 3 of postpartum. Whereas her general physical examination is unremarkable and there are no worrisome findings on pelvic examination. Which of the following best term describes the diagnosis? Please ever don't jump into the question. Don't feel sympathy and empathy for the question, the candidate that is given in the question, and jump into depression. It is very clear-cut answer that it is nothing but postpartum blues. Okay, postpartum blues. Yes friends, why it is not postpartum depression? I want anyone to answer this. If you answer this, I will recommend MSOG, the topmost medical college. Why it is not postpartum depression? Why everybody is sticking into blues? If you know that, then you know the concept, then there is no need for discussion. Why it's not depression? Because yes, somebody's answering. Very good, very good. Most commonly seen revolves within weeks, but more commonly seen is that this is a catchy word. Okay. So please, yeah, very good, very good. So basically, what happens is that, as all you know, postpartum blues is nearly 75%, whereas postpartum depression is only 10 to 15%. Postpartum psychosis is very rare, and the onset is usually day 3 or 4 of postpartum, and it will be less than 14 days. Okay, within 14 days it will resolve. Whereas postpartum starts within 4 weeks, it will be for more time, and naturally it will meet the criteria for depression. And very importantly, they'll be having symptoms in postpartum blues as labile mood, tearfulness, worry how will I take care of the baby. Whereas postpartum depression, when they have all the criteria, I think by this time you know all the criteria of depression: low mood, anhedonia, fatigability, decreased sleep, decreased appetite, hopeless, helpless, worthless. And along with that, if you anywhere find a word suicidal ideas, please mark my words, please mark my words, if there is suicidal ideas in the question, it is not postpartum blues, it is already gone into postpartum depression. Why you should be very much concerned here? Because why you should be very much concerned here? Because when you make the diagnosis, the treatment will differ. When it is postpartum blues, the treatment is going to be, the treatment is going to be, again, this was a question that was asked. A mother is having so and so, what is the treatment for the above mentioned patient? What is the treatment? It's basically reassurance. Don't give free advice, just reassurance and sleep regulation. Make sure that she gets enough sleep. Okay, whenever clients come to me, I'll always tell to them during the postpartum time, if they come to me, I'll tell that the child should be with the mother only when the mother is feeding the baby. All of the time the child should be with the any other attender, so that she gets good sleep. Whereas when it comes to postpartum depression, see the question clearly. See the question clearly. If it is just postpartum depression, the answer is antidepressant. If the question says that the person is having postpartum severe depression with the suicidal ideas, what is the answer? What is the answer? You cannot make a mistake. You cannot make a mistake. What is the when a person is having postpartum depression and also is having suicidal ideas, what is the treatment that you are going to offer? What is the treatment that you are going to offer? Very important, very important, very important. What is that? No, I'm not going to give Brexanolone. I'm not going to give Sertraline. No. What is the treatment that you're going to give? Yes, close your eyes. Whenever you find suicidal ideas, severe depression, the answer that should come into your eyesight is ECT, that is electroconvulsive therapy. If they ask you a person is having postpartum depression and what are the recent advances, then you can go for the drugs that you have mentioned. What are the drugs? Brexanolone, Zuranolone. Brexanolone and Zuranolone. Yes, yes, very good. Next, we'll go to the 2021 question. Okay. While therapy sessions, a therapist is developed unconscious, please concentrate, unconscious and conscious feelings towards the patient. See, don't worry, there'll be a like paragraph question. Only the direction is important. Therapist has developed feelings towards the patient. What is it called as? What is it called as? Anybody can tell me the answer? Very simple. Very simple. Very simple. Answer is, answer is wonderful, wonderful, Bona Venkat. Counter transference. Counter transference. Very simple, very simple. I've told it many times. Okay. Sigmund Freud was a wonderful thinker of his time, and he is, we all love Sigmund Freud. That's why psychiatrists have a beard. Okay. Now we all, because we try to identify ourselves with him. Now he has given wonderful contributions in psychoanalysis and everything. And very important thing, the recent questions. See, previously they used to always ask questions like, who gave psychoanalysis? Sigmund Freud. Who gave conversion disorder? Again, Sigmund Freud. Who gave pleasure principle? Again, Sigmund Freud. Who gave psychosexual stages of development? Yes. Now these were the questions that they were asking previously, but the examiners now they want to just trick you a bit. So they are asking questions on transference and countertransference. Very simple. There is a doctor here. There is a patient here. If a patient is having a unconscious channelization of emotions towards a therapist or the doctor, we call it as transference. We call it as transference. Yes, 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 yes. When there is a channelization of emotions from the therapist towards a patient, please ever read the question. To see, most of the time I find students becoming hyper when you know that I know this question. Please read. It's like a equation from the patient towards therapist. It is transference. From therapist towards patient is counter transference. Yes, this transference can be positive or negative. Counter transference can be positive or negative. That you are least bothered. Whether the patient is happy with the doctor, angry with the doctor, sad with the doctor. No, direction is only important. From patient, you are all patients. From patient towards therapist is transference. From therapist towards patient is counter transference. As simple as that. Yeah, certain patients come and say that Sir Vivekanandan sir saved my life. He's like he's a gift to CMC Vellore. He's a gift to Jipmer. They used to praise. Some people will come and say this person is the most irritating doctor I've ever seen. Yes, that is nothing but transference from the patient towards therapist. From the patient towards therapist. Please ever don't make a mistake here. From the patient towards therapist is transference. From the therapist towards patient is counter transference. Yes, yes. A man sits on his balcony naked, mostly in the evening when there are a lot of people in the park. What is the disorder? I somehow feel that examiners love paraphilias. They love paraphilias. And you all have been reading paraphilias for many years together. I know that you people have a lot of interest on this topic, so you will be definitely getting a mark here. What is the answer? Tell me what is the answer here. What is the answer here? Anybody? Answer is exhibitionism. Answer is exhibitionism. Okay, please concentrate. Please concentrate. A person undresses himself in a public, where others are seeing him, and it is not his partner, it is unexpected strangers in a public place. It is called as exhibitionism. Yes, good. A person rubs his one's genitals or unexpected strangers, mostly in a public place or a public transport. What is this called as? Let me see who's going to answer this. What is the answer for this? What is the answer for this? Wonderful eagle eyes. Answer is fraudurism. That is rubbing the person in front. That is I'll remember. So it is nothing but it is fraudurism. Fraudurism. Yes. Yes. A person gets a sexual eye on seeing others dressing or undressing or having a sexual encounter. What is this called as? What is this called as? What is this called as? Very simple. There are a lot of movies that has come in this as name. What is this? Voyeurism. Voyeurism. Very good. You all know this movie 50 Shades of Grey. 50 Shades of Grey deals with the word called the word paraphilic disorder called as sadomasochism. That is, sadism means a sadistic person. He gives pain. Masochism means he takes pain. And there is a word called as algolagnia. Anywhere we read this word? Anywhere you dealt this word recently? Where? In this month only. Where? You should have all given your INACT exam, right? You read this word. Yes. Again, the sexual pleasure involving pain. Yeah. Yes. Yes. Now again, there will be a question. A person who dresses. A person who dresses within four walls like opposite gender to get a sexual high is called as. Is called as. Can be either transvestism or eonism. Yes, it is nothing but the same. It's nothing but the same. Yes. Now, sexual gratification on having sexual relationship with cadavers is called as what? Brilliant, brilliant, brilliant. I'm very happy. Yeah, I can understand that the tech team is working on it. Educate doctor. Yes, very good. It is nothing but necro. Yes, friends, is this clear? Is this very clear? You are not going to make a mistake in this. Okay, okay. I know that you have been, you need not take MBBS to learn all this. These are the very famous in the movie. On most of the movies, you should be hearing this. There should be no mistakes from this part. Yes, yes. Very good. Very good. Next, a 53-year male who's a chronic alcoholic. Okay, he's an alcoholic. He tried to stop using alcohol after several requests by his family members. He started feeling uneasy day 3. My God, this is a person who is having the most kind heart in on earth. Okay, he has literally chosen words from the classical textbooks of psychiatry. He's an alcoholic. Family members telling him to stop alcohol. He's stopping alcohol on day 3. Even without going to the question, I know the answer, but we'll read the question. He's having clouding of consciousness, insomnia, visual hallucinations. He's agitated and started abusing everyone around him. He's shaking and sweating profusely. Okay. Yes. Should thank him. Should thank this examiner. What is the answer? Answer is delirium tremens. Delirium tremens. Again, I'm going to put 5 stars here. 5 stars here because it is a repeated question. Yeah. I always say that whenever there is a question on delirium, okay, please concentrate. Please concentrate. There are very catchy words that you should know. The catchy words is there is something words called as altered sensorium. A sensorium will be altered. Yes. Next, there will be something called as clouding of consciousness or is confused. Yes. Next, is confused. You have a problem with the attention and concentration. You will have disorientation to time, place, and person. Yes, very good. You will have visual hallucinations. You will have Lilliputian hallucinations. The first case of delirium tremens that I saw in my clinical practice was a case where we had Lilliputian hallucinations. A person saying that, sir, 2 centimeter people are standing in front of me. Small elephants is climbing on my shoulders, sir. Lilliputian hallucinations. And very importantly, sun downing phenomenon. Why? When the sun goes down, there will be increased symptoms. That is delirium. That is delirium. Is it clear, friends? Is it clear, friends? I'm telling you, asking a one-liner is the most easiest job for the examiner. If an examiner is framing a clinical related question, he has to put his heart and soul. And this examiner is a very kind-hearted examiner where he has used all the words. There is altered sensorium. He is agitated. He is disoriented time, place, and person. He's having visual hallucinations and clouding of consciousness. And very importantly, the question will be the person after 72 hours after last drink, is having altered sensorium along with this is the word tremors or trembling. That's why we have named it as delirium tremens. Are you able to find it, friends? It is actually delirium with tremors is called as delirium tremens. Is it clear? Is it very clear? Is it very clear? Next. Very good. Please have it very clear in your mind. So the answer is delirium tremens. A girl of 18 years presents with increased talkativeness, elevated mood, poor familiarity, pseudo hallucinations, increased sexual activities, high energy, decreased sleep. What is the diagnosis? Tell me. Very simple. Very simple. Again, it's a banana question. Again, it's a banana question. You should be like thankful for examiners like this. What is the answer? Mania. Yes. 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 You should all know what are the symptoms of mania. By this time, you know what is mania. So, what are the catchy words that you will search in mania is the person will have what mood? Elated mood or euphoria mood will be there, and they will have what? Increased psychomotor activity. You will not be sitting. Okay, if you have seen once a mania patient, you will not forget for your lifetime. Psychomotor activity. They will have what is called as flight of ideas. Do you remember this word? Flight of ideas. Yes. And they will have what is called as pressure of speech. They'll be continuously speaking. Pressure of speech. And they will have one delusion. Can anybody tell me what is a delusion called as? What is a delusion called as? Grandiose delusions. Grandiose delusion. Most common hallucination seen in delirium tremens, obviously it should be visual hallucinations, dear. Arunava Maiti. Yes. And very importantly, they'll have decreased need for sleep, which is hyposomnia. Yes. Is it clear, friends? Yes. Very, very, very. This is, I would say that this is a second year MBBS question. It's not even a NEET PG question. Yes. Which is a formal thought disorder. My God. See, basically what happens is that this thought form stream, then tempo, continuity, possession, and content is all asked for PGs in third year Viva. Okay, during their after their MD psychiatric practicals in the Viva, they will ask this question. But some sadistic examiners ask in NEET PG entrance itself. Okay. Now what you should know is, okay, I remember this mnemonic. It's a very bad mnemonic. Okay. If you have a better mnemonic, please tell me. What is that? Is that I remember it as a farmer who's also a farmer who's also a doctor. Okay. Who's also a doctor who wants to buy a tractor. Okay. Will get loan. A farmer who's also a doctor who wants to buy a tractor will get loan. So basically, thought form disorders is nothing but derailment, tangentiality, loosening of association, neologism. Keep it by heart. Farmer who is also a doctor who wants to buy a tractor will get a loan. What is derailment? Just like a train. Okay, it starts, but it takes a new track and it is derails. That is derailment. What is tangentiality? Remember this, reading all this. Okay. Now what happens is that this is a topic that I want the patient to speak. He talks unwanted things, touches the topic, again speaks unwanted things. That is a tangentiality. What is loosening of association? I ask the person, tell me something about your mother. He says that, sir, Barack Obama was once a president. It is raining outside. I didn't cut my nails. So basically the question that you ask and the answer that you speak is not relevant. And one thought, another thought is not connected. That is loosening of association. Neologism is nothing but, I have told you this in the clinical case, where one of the patient, when I interviewed him, within 15 minutes he said sepakatu, and he walked out of the room. Again next day I interviewed, again he told sepakatu and he walked out. After 1 month only I realized that sepakatu means I want water. He has formed a new word. Okay, forming new words which is not in the dictionary of that language. That is called as neologism. Yes. Yes. Is this clear? Is this clear? Very clear. Very clear. Yes. Yes. Next we have something called as stream. In the stream we have two parts, tempo and continuity. Tempo is a bit, I think you all know that. One is called as circumstantiality. What is circumstantiality? Anybody can know this? Beating around the bush. To add unwanted. This is the topic you want to start the patient, and this is the goal. Okay. Rather than going directly to the goal, you will talk unwanted information, and you reach the goal. That is called as circumstantial. Okay. As a patient got something about What is flight of ideas? Flight of ideas is nothing but the person will go like a flight. Okay, from one point to other point, keep on junking, but there will be connection. Okay, that is called as flight of ideas. Flight of ideas, which is again a very characteristic feature seen in India. I want you to concentrate here. This is a question that has been asked. Continuity is nothing but perseveration. Can anybody tell me what is perseveration? Can anybody tell me what is perseveration? Please tell me what is perseveration. What is perseveration? Exactly. We all passed our MBBS with Viva by answering unwanted using these form disorders. Perseveration. Raghuramji, that is clang association. What is perseveration? What is perseveration? Perseveration is nothing but PPP, persistence beyond point of relevance. Yes, yes, yes. So I am asking you, what is your name? My name is Raja. Where are you from? Raja. Did you eat your breakfast? Raja. Are you able to understand my question? Raja. So basically the first question and the first answer was relevant. Yes. But once you change the question, he's sticking on to the same answer. That is persistence beyond the point of relevance. That is called as perseveration. Again, I'm asking the question. Wow. Vaishnavi Kundla. You should take MD Psychiatry, ma'am. Yes. Next, we have something called as thought to possession. Thought to possession is nothing but you have two things. One is called as obsession and thought alienation phenomenon. Can anybody tell me what is the difference between these two so that I can go to the thought content? Both comes under thought possession. But what is the difference between obsession and thought alienation phenomenon? Yes, friends. Fast. Obsession. What is the difference between thought? Both comes under thought possession disorders. Obsession and thought alienation phenomenon. What is the difference? One catchy word. In the exam, you will see this. What is it? We'll see this. What is it? See, basically, what happens is thought possession and obsession is that a person comes and says that, sir, suddenly my thoughts come to me that my hand is dirty. I feel that my hand is dirty, so I'm feeling very much distress about the thought. But I know that it is my own thought. Are you able to get it? It is my own thought. Please catch the word. Whereas in thought alienation phenomenon, the patient will say that, sir, suddenly the thought is inserted into mind. It is inserted into my mind. It is not my thought. Okay. This is a word which will be able to differentiate whether it's obsession or thought alienation phenomenon. Yes. And thought content, I have already told you many times, thought content is nothing but delusion. I'm not going to explain what is delusion. I want you to type what is delusion. If you're answering correctly, I'm going to skip. Just tell me what is delusion. Delusion is nothing but, usually I always tell in the exam, if there is a kind-hearted examiner, if I become an examiner, I will ask this question. Delusion is nothing but basics. I'm telling you, friends, basics. Whenever the examiner is bored, is not in a good mood to frame a question, is not going to write a clinical related question, he is going to ask basics. Ajra Fatima, what is false? Very good. Thank you. False, fixed, firm, belief, with the. I want somebody to finish. Yes, which is a subjective certainty. Very good. Please finish it. I'm waiting for that catchy word. Unwarranted belief, not fact. Wonderful. I'm going to give it to Subramanian. Wonderful, ma'am. Outside one's socio-cultural background. Anything which is common in the society, we don't call it as delusion, right? So outside one, socio-cultural background, cultural background. So that is a delusion. Please cap this very clear. Yes. Next, we'll go to NEET PG 2020. Wow, I love this question. I love this question. Okay, this is a standard question which should be asked for NEET and INACT students. Let me see who's going to answer this. A female patient with history of depression came to the OPD and was prescribed imipramine. Imipramine is an antidepressant tricyclic. 1 week later, bystanders complained that she was having excessive talk, increased activity. What will you advise on follow-up? Answer this. Answer this. I pray God all of you should get the seat that you love, man. This much hard work, you should definitely get the seat. Tell me this. This is a very important part. I want everybody to answer this. This you cannot afford to make a mistake. What is this? There is a depression. You are giving an antidepressant. After that, the patient is having excessive talk and increased activity. What will you advise on follow-up? Continue the current antidepressant and add mood stabilizer. And if you are going for C, are you sure? Stop the antidepressant and start mood stabilizers. I would offer that stop the current antidepressant and start a mood stabilizer. Okay, I'll explain why. Don't get confused. Very simple. Okay, please. A depressed patient comes to your clinic for the first time. What is the treatment of choice? What is the treatment of choice? An antidepressant. A depressed patient, okay, with one history of mania in the past. What is the treatment of choice? What is the treatment of choice? What is the treatment of choice? Will you give an antidepressant here? Just tell me that answer. Will you give an antidepressant here? Because if I give antidepressant here, it will normalize the patient. If I give antidepressant here, there is a chance of switching. So I would go for a mood stabilizer. Mood stabilizer. Third and very important thing, a person. Now this is a question. A depressed patient is there without any history, with no history of mania, and you start the patient on an antidepressant. After that, he has manic symptoms. What is the first thing you will do? Actually, the question would be, what is the first best thing you will do as a psychiatrist? Stop. There is a lot of questions in psychiatry where the answer is stop the offending agent. Starting from neuroleptic malignant syndrome to the development of mania after antidepressant, stop the offending agent and continue start the patient on a mood stabilizer. Now I ask a question, sir. A patient is coming with depression, sir. He has no mania in the past, but how will I know that this depression has a chance that it can go into mania? Anybody who's going to answer? But am I able to understand my question? See, if the person is coming with depression, how do you predict? How can you predict that this is going to resolve with antidepressant, or there is a chance that it can go into a mania? Is there anything which will specify? There is no past history of mania. Is there anything which is specifiers? We call it as bipolar specifiers. Anybody can answer me this question? Yes. When there are multiple episodes. Okay, when there are multiple episodes and the episodes are very small, okay, and they are associated with the psychotic symptoms, and this the depression being after a postpartum, and they are having a lot of atypical symptoms. These are all will be like red flag signs. You should be very cautious that it can go into mania. It does not 100% say. We call it as specifiers. We'll, whenever in PG ward rounds, we'll ask, is there any bipolar specifiers in this patient? Is there multiple episodes? Is there small episodes? Is there psychotic symptoms? Is there postpartum episode? Is there an atypical symptom? Then we'll ask the patient under very strict follow-up, so that is the patient going to develop into mania? Again, these are postpartum specifiers. Just keep this in mind. Next, a patient with bipolar affective disorder and lithium for 6 months. After fasting for a day, patient presents with seizures, coarse tremors, confusion, weakness of limbs. What investigation would be appropriate to diagnose this condition? What investigation would be appropriate to diagnose this condition? I'm telling you, friends, lithium is the bread and butter for the examiners. Okay, if I count, there will be 22 points which can be asked, notorious points which can be asked for exam under lithium per se. Yes, the answer is serum lithium. The answer is serum lithium. But I'll just add on to all the other important points. Lithium was given by a person called as John F. Kede. It is a liver friendly drug. It goes via kidney. It is a drug which has a narrow therapeutic index. Standard textbook says that it is 0.8 to 1.2 milliequivalents per liter. Watchful that this can, what does the damage that is going to cause to the kidney is nephrotic syndrome and nephrogenic diabetes insipidus. What happens to the developing fetus, the uterus? What happens to the developing fetus in the uterus? The mother takes lithium. Cannot afford to make a mistake. What is the answer? What is the answer? Epstein's anomaly. Epstein's anomaly. Yes, yes, yes. And very importantly, the toxicity can be of multiple types. Can anybody tell me, first of all, why there is a toxicity? Why, how can a toxicity occur? You know that it is 0.8 to 1.2 milliequivalents per liter. You are very cautious. Then how that the person can develop toxicity is because there are various reasons. One, the person has increased intake of drug, or the person is having a kidney failure, or there is drug interactions. What are the drug interactions you should be careful of? Diuretics, NSAIDs, and ACE inhibitor. Yes. And what happens is that when a person is having mild levels, like the symptoms would be vomiting, tremors, and the tremors would become coarse tremors. Okay, if it is more than 1.2 milliequivalents per liter, there will be 1.5 to 2.5 milliequivalents per liter. Confusion, agitation, there is a chance that it is 2.5 to 3.5. And coma, seizures, and hypothermia, it is more than 3.5. And very importantly, when a person is having increased toxic level, that gold standard, whenever there is a word called as gold standard treatment of choice, the answer is hemodialysis. Hemodialysis. Again, a star question. I'm putting 4 stars here. Again, it is asked. Okay, lithium is bread and butter. Okay, the examiners have built their retirement villa by selling lithium. So they love lithium, they respect lithium. Please start respecting lithium in your preparation now itself. Yes, friends. Yes, friends, this is clear. Yes. Next. MBBS first year girl comes to OPD complaining of intermittent. Oh my God. Complains of intermittent episodes of feeling of impending doom, accompanied by intense perspiration, palpitation, and difficulty in breathing. Due to this episode, she has stopped going to college, usually remains in a room, and insists for someone to accompany her for outside routine visits. What is the most likely diagnosis? What is the most likely diagnosis? Anybody? What is the answer? The answer should be like be firing a gun. What is the answer? Panic attack. This is what I told you, no? Even 10th standard and 12th standard school students don't get questions like this, repeat questions. We are lucky. A patient was recently started on risperidone. Yes. Few weeks later, he developed tremors, rigidity, bradykinesia, and excessive salivation. First line of management for this patient is, let me see who's going to answer this. What is the treatment for this patient? What is the treatment for this patient? Answer for this patient is Trihexyphenidyl. Very good, Raghu. And then, so basically what happens is that please concentrate. This is a table that you should not forget till your exam. Okay. First and foremost is dystonia. Dystonia is a very earliest symptom, less than 24 hours. Okay, you start the patient on an antipsychotic, you don't cover the patient on any other drug like trihexyphenidyl. The patient will develop with dystonia in the either it is in the eyelid or it is in the neck muscles, antrocollis, torticollis, retrocollis, or in the legs, hands. So it is nothing but dystonia. Nothing but dystonia. And what is the treatment? If it has already there, you give promethazine or benztrophin injection. Okay, or benztrophin injection. Or prophylactically, can go for THP. What is THP? Just now we told trihexyphenidyl. Yes, this is very clear. This is very clear. Akathisia. Akathisia is around 72 hours. The clinical syndrome will be restless. Okay, a person who is restless, I'm feeling restless, I'm not able to sit in a place. When the nursing staff tells that please don't walk like this, go and sleep, the patient says, sister, I don't have a problem, I'm not scared, but something is not making me to lie on the bed, something is making me to walk. Okay, that is the classical restlessness. If you see one case of akathisia, you will not forget in your lifetime. And the treatment for akathisia is propranolol. Parkinsonism is a question that we have asked. It happens after weeks, where the person will have the triad bradykinesia, rigidity, and tremors as in the question, and the answer is same, exact same of that of the dystonia. Just copy paste it here. And tardive dyskinesia will be at least after 6 months. Okay, that is tardive means late onset, and the person will have chorea-like movements. Chorea-like movements. What are the recent approved drugs? Anybody can tell me? Chorea-like movements. What is the recent FDA approved drugs? There's something called as tetrabenazine, valbenazine. Yes, very good, Mubishra Muhammad. Is this clear, friends? Is this clear, friends? See, they have asked nearly 4 questions from this one particular table for FMG, NEET, INICT. Okay, just know this table. Do not go for deep and all. Time of onset, what is the type of syndrome presentation, and what is the treatment? That's more than enough. Very good, Sultanafil. Next, we'll go to the 2019 question. This is a wonderful question. Intense depression and misery without any cause is called as. It's called as. Anybody can tell me this? Intense depression. Intense depression and misery without any cause is called as what? Anybody wants to answer this? Anybody wants to answer this? What is this? Wonderful. Melancholia. Please have it very clear. Okay. Please have this very clear. Please have this very clear. Melancholic depression. Why it is called melancholic depression? It was the word melancholia was coined by Hippocrates to give importance to whom we are using the word for the melancholic depression. The characteristic word is intense depression or intense misery. Okay. They'll have what? Early morning awakening. You will have early morning worsening of symptoms, increased guilt, increased tiredness. And with the treatment of choice for melancholic depression is SSRIs. I'm telling you, friends, it is called as endogenous depression because usually during your exam preparation you will be depressed. Okay, what you're having, you're telling your parents that you're all depressed, you're worried and all that, right? That is not melancholic depression. Okay, they will have everything in their life. They'll have everything in their life. I have a client, like in my private practice, if I ask for some, I visit MI homes and MR homes, mental illness homes, and I just ask for sponsors, they will give a check of 2 lakhs. Okay, they don't have any financial problems, everybody is settled, but still she will have a cry intense tearfulness, worries, why am I alive on earth, I'm not a useful person, I'm guilty. So without any cause, the person is having increased depression, then we call it as melancholic depression. Okay, that's what. See, this is how we feel very happy when we see a question which is we see in clinical practice. Again, a very good clinician has framed this question. So, without any cause, a person is having intense misery, early morning awakening, early morning worsening of symptoms. Answer is melancholic. And this is, in exposure and response prevention therapy, which one of the following is a poor prognostic factor in OCD? What is the type of disorder which has a poor prognostic factor? Anybody? I definitely know you know the I know that you know the answer. Please tell me the answer. Yes. Answer is hoarding disorder. Very good. I'll just ask this one question. What are the disorders that is classified under OCRD? Obsessive compulsive related disorders. It has been asked in your NEET and also INICT. I want everybody to answer. Yes. What are the disorders that comes under OCRD as per DSM-5? DSM-5 has classified one disorder called as obsessive compulsive related disorder, where you'll have this OCD. You'll have what is called as hoarding disorder, where you'll have difficulty to get rid of things. Okay, hoarding disorder. Then any other disorder? Body dysmorphic disorder. Body dysmorphic disorder. Wonderful, wonderful, Sitanoffel. Wonderful, Mansi. Is there any other name for this trichotillomania, Mansi? I will call it as hair pulling disorder. I will call it as hair pulling disorder. Any other disorder that we have left? Let me see who's going to answer it. Very good, Krishnita Nita. Skin picking or excoriation. Shall be classified under C. Yes. Yes. Which of the following is not a risk factor for delusional disorder? It's a very one-liner. Which is the following is not a risk factor for delusional disorders? Anybody wants to answer this? Sensory impairment, early immigration, social isolation occurs at an early age. Occurs at an early age. Usually people who go to travel, okay, where are they travel and they go to a new place when they have a problem with adjusting with the environment, and where the language is all new, they feel that people are plotting against me, talking about me, making fun of me. So basically you're an immigrant and you are socially isolated, you're not moving, gelling along with people. Actually there is a chance of delusional disorders, but it occurs at a late age. Okay, so this is it's not an except question. Okay, so the answer is occurs at a late age. Okay, now this is a very important question. I would say that this is not a NEET question, it's an INICT question. Confusion assessment scale is used for which of the following? I can still remember whenever there is a delirium case that is admitted in our ward, or whenever there is a delirium call over that is given in the different departments, my HOD in JIPMER used to always say, did you put CAM? Did you put CAM? What is CAM? Confusion assessment method. It is used for delirium. It's used for delirium. I've prepared this table only for you. I'm not going to tell the answer. You are going to tell me the answer. What is confusion assessment method used in? Fast. Confusion assessment method is used for. Tell me the answer. Very good, Mansi. Answer is confusion assessment method. Now we told you, not delirium. Mini mental state examination is used for. Mini mental state examination is used for. Answer should be firing. Very good, Dr. Guide. Very good, Pinku. Pranalini. For mini mental state examination, the answer is very good. Dementia. Very good, Mansi. Hamilton Depression Rating Scale is used to score or evaluate or the classify the severity of which disorder. As the name itself denotes, it is depression. They will not ask it as Hamilton Depression Rating Scale. They will use the word HAMD. should know that HAM-D is nothing but Hamilton Depression Rating Scale. Again, they will not ask Young's Mania Rating Scale. They will ask it as YMRS, which is for mania. Similarly, they will not ask Ailes-Brown Obsessive Compulsive Scale. They will call it as Y-box. Y-box. It's for OCD. Please know the names. As they have asked SCOFs, they will ask you. Again, SCOF questionnaire, you know, the answer is eating disorders. Just now I discussed. Now let me see who's going to answer this. PHQ 9, Patient Health Questionnaire 9 is used for. My students will know the answer. Patient Health Questionnaire 9 is used for. What is the answer, friends? Yes. Where it is used? Patient Health Questionnaire PHQ 9 is used for. Wonderful, wonderful, Raghunandan. Screening depression. Please make it very clear. Please make it very clear. HAM-D is used for severity rating. See, I have 1,000 people in front of me. I have to find, see, for example, all 232 are sitting in front of me. If I have to find that you people are having depression, I'm not going to sit and talk with half an hour for everybody. I'm going to give PHQ 9, which has 9 questions. And if you're going to get a more score, then it means that I'm going to screen you as having depressed. And out of them 10 or 15 people, then I will go and rate you on HAM-D. Are you able to find the difference? Give a thumbs up if you're able to find the difference. I don't want you to make a mistake. 1,000 people are sitting in front of you. Screening questionnaire PHQ 9. 4 student patients are in your clinic. For rating the severity, you will use HAM-D. Give a thumbs up if you're able to get this. Never make a mistake. Never make a mistake. Sad person scale is used for. Sad person scale is used for. Let me see who's going to answer this. I'm going to recommend MD Psychiatry for you. Sad person scale is used for. Anybody? Just give a blind guess. Sad person, a person who's sad. What will he do? Depressed person. What does it do? What will he do? Very good, very good. Thank you, Murnalini and Mubashra. Tell me what is sad person scale? Sad person. Depression, pain management, seasonal affective disorder. Wow. You will all pass a NEET exam if it is a Viva, man. Wow. Very good, Mithun Kumar. Suicidal ideas. When there is a patient comes with suicidal ideas or suicidal attempt, okay, and you should know that whether the person will attempt again or the risk of attempting again is more or less, then you use one scale called a sad person scale. Okay, you use the sad person scale. HEDAS assessment. HEDAS assessment is used for. This is again an INSCT question. HEDAS assessment is used for. Anybody? HEDAS assessment is used for what? Adolescence safety. There you will have questions on sex, suicide, and substances and behaviors. Okay, so dangerous behaviors. So adolescent safety. Yes, friends, HEDAS assessment. H. Every word will have one mnemonic, but don't worry, they will not ask what is SCO, what is HEAD, what is SCAD, and all. They'll just ask you assess whether you know where it is used in psychiatry. And again, this is a very simple question. Not true about somnambulism among the following is. Okay, I always recommend please read whether it is not true except. Okay, because that you can make there is a chance that you will make a mistake. So somnambulism means what? Sleepwalking. So also called as sleepwalking is right. Okay, disorder of sleep arousal, yes. Low level motor or skill function is present. Actually, you will walk. Okay, imagine that you are lying on the hall, you see a person who's sleepwalking, he goes into the kitchen, comes out, you feel that okay, this person has come to take some water. It'll be like that. Like more of a complex movement will be there, but you'll know he's not conscious, right? So patient conscious is not preserved. That's the best question. That's the best answer. Next, I will also ask certain one-liners in sleep disorders, which is often asked. Night terror is seen in which sleep? One-liner. Night terror is seen where? Nightmare is seen where? Fast. Night terror is seen where? The answer should be pouring. Night terror is seen in which part of the sleep? NREM sleep. Nightmare is seen in which part of the sleep? REM sleep. Next, what is the deficiency that causes narcolepsy? What deficiency causes narcolepsy? Very good, very good. Nita, Krishnita, Nita. I want what deficiency causes narcolepsy? Start. Very good, very good, very good, Dr. Guide. What deficiency causes narcolepsy? Hippocretin or orexin deficiency. What is the recent FDA approved drug for restless leg syndrome? Recent, I want recent. Don't tell me pranipexole dropinerol. It was some 2 years before I was teaching this. From last year itself, we changed the answer. What is the treatment of choice for restless leg syndrome? What is the treatment of choice for restless leg syndrome? Very good, Divya. PG. What is restless leg syndrome? Treatment. Wonderful. I'm giving it to GABA pentin, Dr. Ramya. GABA pentin. GABA. Yes. Drug used for smoking cessation is? Very simple question. What is the drug which is used for smoking cessation? What is the drug which is used for smoking cessation? What is the drug which is used for smoking cessation? What is the drug which is used for smoking cessation? Answer is varenicillin. Very important. We have something called as nicotine patch, nicotine gums. Can I drink coffee along with nicotine gums? Can I drink coffee along with nicotine gums? Fast. We are not dealing only with important points. Don't ask me concepts. Where do you use? Can I use coffee, sir? I usually used to give cigarette along with coffee, sir. Now you have told me to take nicotine gums. Can I take nicotine gums along with coffee? Premature ejaculation is deposit in deer. No doubt. No confusion. Nicotine gums. No. Please don't take any hot beverages. No hot beverages. Very good. Next, they ask you what is the best drug for nicotine cessation? What is the answer you'll give? Varenicillin. Yes. Now this varenicillin, what is the mechanism of action? Somebody has given the answer already. Super smart, hyperactive kid was in this group. Forgot the name of the child. Somewhere the name was there. Anyway, can anybody tell me what is this varenicillin? Can you tell me what is the mechanism of action? Is it alpha 2 beta 4, Dr. Ramya? Are you sure? Alpha 4 beta 2. Okay. And what is the question that they are asking? Which is the most effective nicotine gum patches in NLS? Everything has one word. See, very good question that you have asked. See, gums is one which is used by the one words that you should know is chew park chew technique, and don't use any coffee. Next, patches is the one which is for a long time. One patch is for 12 hours. Okay. Inhalers is a behavioral substitute. Okay. because it will be used as a inhalation, so it will be like a that puffing, so they'll be having some behavioral substitute. Now there's a question that is asked: a person is depressed, and also having nicotine addiction, and you're planning to use an antidepressant which is used for depression and also for smoking cessation, then you will use what? Very, 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 very important question. What is the answer for this? What is the answer for this? Bupropion. Now, bupropion has 7 words. Bupropion comes under what class of drug? Bupropion comes under what class of drug? Bupropion comes under what class of drug? NDRI. The problem, as I told you, it can cause seizures. There is a 2 questions that will be asked. It is a drug which has least sexual side effects. It is a drug which has the least weight gain. Okay, I'm not sure whether you have gone through FMG question banks. As we teach for FMG students also, these are the questions that they will ask. Bupropion is a drug which is used as an NDRI, which is among the least sexual side effects. Bupropion, that's why we use it in hyperactive sexual desire disorder, and is a drug which has the least weight gain. This you know the answer. Premature ejaculation is a disorder of which phase of sexual cycle? Wonderful. I think you have read the question. Aisha, you're going to get the seat this year itself. Paka, 100%. Premature ejaculation is a disorder of which of the phase of sexual response cycle? My God, what is happening? Pakka, this again a 7th standard school question. Brilliant, Mansi. You deserve an MD psychiatry seat. What is the answer for this? Premature ejaculation is a disorder of which phase of sexual response cycle? This is orgasmic phase. Morbid fear of darkness is what? Morbid fear of darkness is what? What is morbid fear of darkness? Darkness, night, darkness. Oh my God, what happened? Nyctophobia. I just have an idea about all the named phobias. I'm not sure whether it is clear in that. Yeah. So basically, where we have something called as acrophobia. Acrophobia is nothing but fear of heights. Agoraphobia is fear of open place or marketplaces. Acarophobia. Car is full of bugs. Okay. Remember this Titanic, the Mummy movie. A car full of bugs, small bugs. Okay. Ailurophobia is cats. Claustro, closed spaces or lifts. Zoo. Your friends all will be in zoo, animals. Then nyctophobia is darkness. Thanatology, study of death, is called as what? Thanatology, thanatophobia. Yes, yes, they might ask. The nyctophobia has been asked. Agora and acro, they will ask to confuse you. Acro means height, agora means fear of open place or marketplace. The last question paper that I'm going to go is actually 2018. There are too many child psychiatric disorder questions, which was very happy for us. Habit disorders are all except. Anybody can tell me the answer for this? Habit disorders are all except thumb sucking, nail biting, temper tantrums, tics. Many of the students got it wrong at that time because actually this was not expected. Okay, habit disorders and all, because there's a PG level question. Okay, when we want to just pick our PG students, we'll ask this question. But let me see who's going to answer this. Is it thumb sucking, nail biting, temper tantrums, or tics? Wonderful. The answer is temper tantrums. Why? Please concentrate. Have this as an image. I put this as image so that you should know, because this is something pediatric psychiatry, right? Pediatric psychiatry is not you see day in and day out. So I thought that if this is shown as a picture, you will have it as a long-term memory, because image memory is always a good memory. So you have something called as thumb sucking, nail biting, tics, and teeth grinding. These are all habit disorders. These are all habit disorders. Yes. Picturize this. Picturize this. Yes. Give a thumbs up. Give a thumbs up if I can jump. Yes. Thumb sucking, nail biting, tics, and teeth grinding. Yes. Yes, friends. Very good. What is the new name for mental retardation according to the American Association of Mental Retardation? What is the new name for mental retardation? Very, 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 very important question. What is the new name? I want everybody to know this. Brilliant, Mansi. What is the new name for mental retardation? MR is a word with that too much of stigma, so they have changed the name to what? IDD or ID. What is IDD? Intellectual Developmental Disorder or intellectual disability or intellectual disability. Answer is disability. Yes. Stereotypic movements are. Anybody can answer this question? Stereotypic movements are. Stereotypic movements are. Wow, Aisha, you have made my day. Thank you. Stereotypic movements are. Is it a sustained posture against gravity, passive inducible movements, repetitive non-functional behaviors, repetitive functional behaviors? Anybody wants to give the answer for this? Wonderful, wonderful. It is nothing but repetitive non-functional behaviors. I'll just include certain important things. See, basically they'll have non-functional repetitive motor behaviors is nothing but stereotypic movement disorders. Examples will be like hand shaking, body rocking, head banging. Now, why are you very much concerned? Let them do that. Let the students, it's like more of a, it would be a soothing phenomenon. Why are you concerned? Because it might cause self-injury and duration is 4 weeks or longer. That is stereotypic movement disorders. Why am I putting all the criteria as that? Because these are all like the eccentric parts of the pediatric psychiatry, which is not very common day in and day out. Okay, so they might ask you this. Antipsychotic, my god, this is very, 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 very 100 times very important. Antipsychotic causing prolactinoma. Antipsychotic causing prolactinoma. What is antipsychotic which causes prolactinoma? Is it which causes prolactinoma? Risperidone. Risperidone. Yes. So there will be enormous questions. Psychopharmacology is like the very important topic. What is the first generation antipsychotic? Answer should be pouring in. First generation antipsychotic. First generation antipsychotic. Fast. First generation antipsychotic. Chlorpromazine. Second generation antipsychotic. Clozapine. Antipsychotic which causes agranulocytosis. Antipsychotic which causes agranulocytosis. Again, clozapine. Antipsychotic which causes, though it is a second generation antipsychotic, causes hyperprolactinemia. What is the answer? Just now we read risperidone. If risperidone causes hyperprolactinemia, what is a drug which you will reversing this hyperprolactinemia? It's done by you one drug. Tell me this answer. I will recommend MD pharmacology for you. Anybody? A person has been started on risperidone, he's having hyperprolactinemia. What is a drug which you will be adding to reverse this hyperprolactinemia? Yes. Yes. Waiting. I'm waiting for the answer. Cabergoline. Antipsychotic. I'm talking about antipsychotic. Promethazine. I'm talking about antipsychotic. Talking about antipsychotic. Aripiprazole. Aripiprazole is an antipsychotic. They ask you what is the antipsychotic that you will add. If a patient is having hyperprolactinemia, go for aripiprazole. Yeah, aripiprazole. We're talking about antipsychotics, right? So aripiprazole. Yes, yes. What is the notorious drugs which will cause obesity in a person? What is the antipsychotic which is notorious to cause obesity? Very good. Arishmaran sildenafil. What is the drug which causes obesity? Antipsychotic which causes obesity. What is a drug which will be safe in obesity? Tell me this, we'll go to the next question. Wonderful, Mansi and Raghunandan. Clozapine and olanzapine. I'm telling you, it will balloon the patient. Just like this image, it will balloon the patient. Clozapine and olanzapine. Two drugs which is safe in obesity with the psychosis. Anybody can tell me the answer? This was a, don't feel that this is a FMG question last year. A person is having psychosis, he's having obesity. What is the antipsychotic that psychiatrist is going to choose? Very good, Mansi and Jungji Ro. You are from Korea. Aripiprazole and ziprasidone. I remember it as A to Z. A to Z. Aripiprazole and ziprasidone. Brilliant. Is this clear? Is this clear, friends? Yes. Next. Nowadays, Down syndrome is considered under which category disorder? Yeah. Down syndrome will have a borderline to subnormal intellectual disability. So where can we put it under? Anybody can knows the answer? I know that you know the answer. What is it? What is the answer? What is the answer? Answer is oligophrenia. Please remember Down syndrome question. If they ask you the same question, go for oligophrenia. Okay. What do you mean by epiphrenia? Epiphrenia means, what are the catchy words? Okay, epi. See, phrenia means mind, ma. Okay. Phrenia means mind. Okay. Epi means young. What is the schizophrenia that comes under very young age? Anybody? Epiphrenia. What is a very catchy word that comes under epiphrenia? What is called as, it's also called as disorganized schizophrenia. Disorganized schizophrenia. They'll also have neologism and loosening of associations. Again, my God, these examiners should be in good mood, or they should be extraordinarily kind-hearted like me. What is the answer? Until you tell the answer, I will be putting stars. Tell the answer, so that I will change. Come on, man. What is the answer? Premature ejaculation. Yes, yes, yes. Minimal dysfunction syndrome is seen in anybody. There is a lot of there will be some confusion here. The answer is ADHD. Answer is ADHD. Okay. Answer is ADHD. Yes. Now what they will ask in ADHD is that answer is what are the stimulant medications you use for ADHD? Tell me fast. What are the stimulant medications you use for ADHD? Erectile dysfunction, sensate focus. Yeah, you're right here. What is the stimulant medications you'll use for ADHD? Fast, fast, fast. Very good, Mansi. Methylphenidate and dextroamphetamine. The problem with these medication is that what is the problem with these medications? Dexamphetamine, very good. What are the problem with these medications? They cause growth suppression. There might be onset of tics. There will be rebound hyperactivity. What are the medications that comes under non-stimulant medications? Non-stimulant medications are nothing but atomoxetine and clonidine. Your question says that a child is having ADHD along with the tics. What is the drug you will choose? You will choose clonidine. Clonidine. Yes. Yes. Just what is pandas? What is pandas? What is pandas? Any born pediatrician here? The first day of your life, you thought that you are going to be a pediatrician on earth. Please answer this. What is pandas? Pandas. Crossroads between pediatrics, psychiatry, medicine, microbiology, pharmacology, neurology. Pandas. What is pandas? Very good, Mansi. Will get MD pediatrics. Pediatric, autoimmune, neuro, psychiatric disorder associated with streptococcus. Basically, what happens is streptococcus. Basically, what happens is that rather than the antibody affecting the streptococcus, it's affecting your own body, which will present with tics, OCD, and also ADHD like symptoms. A patient, wow, this is a wonderful question. A patient with a history of RTA before 2 months presents with complaints of dreams of the accidents. Okay. He's able to visualize the same scene whenever he visits a place and is afraid to go back to the accident site. Identify the type of the disorder that he might be suffering from. My God, too many pediatricians are here. I thought there is only one pediatrician. Very good. Hey, everybody take pediatrics. Tell me what is the diagnosis? Answer is PTSD. Very good, Sairam. Now, what are the catchy words that you should know about post-traumatic stress disorder? There's nothing but soldier's art, because it was mainly after the World War they diagnosed this. It's also called as Dacosto's art. Yes. It's also called as shell shock. Very good. Then, what are the catchy words in the question? you are having flashbacks, then you are having anxiety. What is the anxiety? To the level that it is autonomic hyperarousal. Very good, Pratuska. Hyperarousal. You try to avoid the situations because you're not comfortable, right? So your avoidance, and also you are dull. A low mood will be. What is the non-pharmacological treatment for PTSD? Anybody? Wonderful, wonderful, Aisha Zaid. Eye movement desensitization and reprocessing. Brilliant, brilliant. Near, educate me, dear. PTSD should have near death experience. You go, you see death, you touch death, you witness death, then you come back. After near death experience like tsunami or where there is a war or there is something like Titanic. Okay, so basically you have eye movement desensitization and reprocessing. And this is very simple. Expression and consequent release of previously repressed emotion is called as. These are all very catchy words, age-old words that were used by Sigmund Freud times. Abreaction. What is abreaction? See, basically what happens is that there will be a trauma or a sexual assault that would happen when the person was a child, and the person will have this unresolved conflicts. And as a psychiatrist, when doing this psychoanalysis, what we'll do is we'll make them to relive the experience. And if you are in that experience now, how do you experience it? Relive the experience, relive the experience. And because of that, there will be emotional. Because of that, there will be emotional release, reliving of experience, and then you will have emotional release. So R-E-E-R, R-E and E-R, that is called as abreaction. Yeah, abreaction. Yes, yes, yes. So abreaction is nothing but emotional release, relieving of experience. It's a wonderful thing. Once you learn psychotherapy, once you take up psychiatry and you're interested in psychotherapy, you learn psychotherapy, you'll be really seeing this. It has a miraculous satisfaction as a therapist. Freud's theory of dream includes all except. Anybody can tell me this? All except. Again, an except question. Okay. What is the answer for this? Very good. Jung Jung Jae. What is Freud's theory of dream includes all except? By this time, you should know the answer. What is that? Answer is. What is the answer, friends? Why all words are coming? A, B, C, D. Everything is coming here. Why? Correlation. So basically, what you should know is, please remember this: condensation, displacement, symbolization, secondary elaboration. See, basically, I'll explain this using the dream that I used to have, and then I analyzed myself. Then I thought that okay, this is what has been working on my mind. I have a fear towards my father. My father is a bit a dark person. I have a fear towards my father. My father will beat me very nicely. Is a new generation Hitler. Okay. Now what happens is that he's a bit dark in color. Now what happens that every day there is one dream that comes to me when I was in 5th standard, 6th and 7th standard. There is a dog, a black dog. It's chasing me, and I hit the dog nicely with a very big stick. Okay. Now what is happening is that I symbolize my father as a dog. Okay. The black dog is chose because my father is dark. Displacement is nothing but I cannot beat my father in real life, but I can beat a dog. So it is displaced. The anger can be displaced to a person where it is accepted. Condensation, 2 to 3%. I don't like my father who is dark. I don't like my max teacher who is also dark. So I condense both of them as one image. That is nothing but condensation. Now this is not this much easy. Why? Because the dream will come as night 9 o'clock, you finish your tuition, you walk for a long time, you had ice cream. After having the ice cream, a dog chasing you, you gave one biscuit. After giving the biscuit, it was very happy. Then again, it started chasing you, you ran, and you have no other way. Then you took a stick, then you bet, and the dog ran away. This will be the elaboration. So you need, it's not as easy. Only when you take psychiatry, when you talk with patients, you know what would be the actual mechanisms that's happening. But just remember it as CDS: condensation, displacement, and symbolization and secondary elaboration. Yes, yes, friends. Again, I'm going to put a star until you tell me the answer. A 55-year-old chronic alcoholic male presented with irrelevant talk, tremors, sweating. He had his last drink 3 days back. If you find this examiner, please order a cake for him, sweet for him. Such a sweet person on earth. Answer is delirium tremens. Is it clear, friends? Is it clear, friends? I told you, no, these are all the most repeated questions. And what is this one differentiates delirium from dementia? I think you should know this. What is the answer for this? What differentiates delirium from dementia? Answer is confusion. Okay. Now I'll just discuss about 3 questions that has been asked in psychiatry related to substance use. That is alcohol. First and foremost, I'll just take 5 minutes of your time. Please don't scold me. A person with Wernicke's encephalopathy will have a triad of. Again, this was a question that was asked in this year 2023. I think I didn't discuss it. But tell me, what is the triad of Wernicke's encephalopathy? What is Wernicke's encephalopathy? It's a triad of. Shanmuga Priya ma'am has taught me this, and I remember it. I will remember it till my life. What is Goa? Tell me. Very good. Shruti. Global confusion. Ophthalmoplegia. Ataxia. Very good. Very good. Very good. Next. Yes. A person comes with Wernicke's encephalopathy with the hypoglycemia. Okay. He's having hypoglycemia and also Wernicke's encephalopathy. What is the treatment of choice? Is it 25D, 10D? What is the treatment of choice? What is the treatment of choice? If I D, 10D, 5D, first thiamine and then glucose. Just tell me the answer. Just tell me the answer. First thiamine. Always give thiamine first and then glucose. I think you'll know the answer because this will be dealt even in your biochemistry. Yes. Next, there's a question. Okay. Korsakoff psychosis is a misnomer where the person will have what? What is the very catchy word of this Korsakoff psychosis? Very good. I'm very happy about Ganesh VS. Very good. Very good. Arunana Maiti. I would be happy if you say thiamine, then any other glucose. Yes. Jung J. Ray. Should take MD biochemistry. Tell me, what is Korsakoff psychosis? What is the very catchy word in Korsakoff psychosis? Confabulation. Confabulation. Yes. Yes. Very good. Very good. Very good. Next. A person wants to stop alcohol. Okay. He wants to stop alcohol. Okay. What is the detoxification agent you will use when this liver is normal? Okay, liver is normal. What is the drug of choice? I usually ask questions in Instagram channel, and this was a question that I asked. What is the drug of choice for detoxification when the liver is normal? Please, please, please open your eyes. Very good, Pratyusha. Please tell the answer. Just five more minutes. I'm not going to take too much of your time. These are all one-liners. Tell me the answer. We'll just move on. What is the detoxification agent you will use when you have? That's all. I'm going to give it to Zahid. Wonderful, Zahid. Chlordiazepoxide. If the same question says that my wife is scolding me, I want to stop alcohol, but my liver is abnormal, what is the treatment of choice? What is the treatment of choice? Arunava Maiti, I'm talking about detoxification. Batman, I'm talking about detoxification. Please concentrate. Very good, very good. Everybody, very good. Wonderful. Pratyusha, again, I'm talking about only detoxification agent. I'm not touching about de-addiction at all. You have to first finish first standard, then only go for second standard. Very good. Krishna Nita. Answer is lorazepam. Answer is lorazepam. Okay. Next. Now tell me, once your detoxification over, de-addiction. For de-addiction, you have a number of drugs. Every drug will have one word. Disulfiram acts by blocking what enzyme? Disulfiram acts by blocking what enzyme? Very good. Arunava Maiti. Wonderful. Wonderful, wonderful, wonderful. Stole drugs. Yes. 4 more minutes. Come on, come on. Disulfiram blocks by what? Blocks by what enzyme? Acetaldehyde. Aisha, very good. Acetaldehyde dehydrogenase. Naltrexone should not be given when the person has deranged what function test? Don't give it when the person is having deranged. Don't give. Similarly, acamprosate should not be given when a person is having deranged kidney failure. Last part. It's not my problem. You were becoming hyperactive, so I'm keep on giving you last points. Age questionnaire is used for. I didn't use it there. I thought I should put it here itself. Age questionnaire is used for. Age questionnaire is used for screening alcohol dependence. Once the person has screened, now there are some thousand. I used to go for this factories for mental health programs. 1,000 staff members and the supervisor says these people are taking alcohol. Sir, see whether these people are having addiction. Then I will go for cage question. I cannot sit and talk with half an hour for each and everybody. Then I will be stressed and I have to take alcohol. So I'll use cage questionnaire. Once out of that some 20 or 30 people are coming, then I will go use a scale. What is the scale for severity of alcohol addiction? There is any scale? This is screening. Is there any scale for severity of alcohol addiction? Anybody? Anybody can tell me what is audit? Wonderful, wonderful. Screening. I would be very happy if Varda says that it's screening. Alcohol use disorder identification test. The last and the final word. Okay. Prochaskas and declimenty. Anybody can tell me what is this Prochaskas and declimenty? Cycle of change. That is, first a person will say, no, I'm taking alcohol because it gives me a lot of sleep and relaxation. Then he will wants to stop alcohol, stops alcohol. Then there is a lapse. Then we should catch the patient when there is a lapse. Otherwise, it's going to relapse. See, these are all the catchy words. Yes, yes. See, the whole psychiatry, the whole 5 years of question papers has been discussed within a short span of 2 hours. It was a wonderful time meeting you, friends. My instinct says that this 2 hours that you have invested is going to pay. Yes, I'm very confident about it. I pray God that all of you get the seat that you like in the college that you love. Yes, friends. Yes, yes. So I'll be keep on posting questions. Please answer in the Instagram so that I'll become more hyperactive. I'll be keeping on giving you too many questions. Yes, friends. Thank you. Thank you for your patient uh, listening and patient, and very importantly, thank you for answering this much wonderfully. Yes, yes. All the best, friends. All the best, friends. Thank you, friends. Uh, Conversion disorder is nothing but conversion of the psychological pain to a functional neurological symptom, dear diagram. So basically, what happens is that where the person will have suddenly presents with a neurological symptom or a blindness or a deafness. Yes, yes. The tech team, I'll coordinate with the tech team. I'll hand over to the tech team, and they will be able to tell it in the comment section, dear. Yes, yes. Thank you, thank you, thank you, thank you. Will definitely help you. Thank you, Sultan Afil, for the wonderful feedback.